Hello guys, starting with this video. In this video we'll be talking about the drains, the instrument, the suture material, how to identify reef versus granny knot and other some common knots. So this are important not only for your general surgery rapid revision, but this is important to any MBBS student who is going for this table Viva. So let's get started with this. So first of all, we'll get started with the suture material. So this is commonly suture material that in your table Viva you get. So if you are smart enough, most of the things are written here. Like this is a vicryl suture material, and this is made up of polygalactine, and this is a braided, means it's a multiflament suture, and this is a synthetic absorbable suture. But when you answer these questions, the teachers or professors are even smarter than you. Then they will ask you, give some example of other multifilament suture. They'll ask you, if this is synthetic absorbable, what is natural absorbable? So you need to know about the suture material, and this is also important from your MCQ aspects. So let's get started with the suture material. So basically, what is suture? Suture, it is a piece of thread that is used for uniting the edges, and these are the various suture materials. See, suture is being done to approximate the edges of the wound. So we have absorbable suture and we have non-absorbable suture. So for absorbable suture, the mnemonic is VCD, and for non-absorbable, the mnemonic is sleep. So what does VCD stands for? V means vicryl, and also it means monocryl. That is both the kryl wala thing. C means chromic catgut and C means catgut. D means Daxon and D means PDS. So we have 6 suture material that comes under the absorbable wala category. So when we talk about 6 suture materials, so some of them have other names also. Like if you see Daxon is known as polyglycolic acid. So remember the mnemonic code. Okay, and this is 90 degree. DO, if you do D, you can be made 9. That is 90. Means this has an absorbable time of 90 days, not degrees. Sorry. Then we have chromic catgut. This is again 90 degree. Then we have vicryl. So this vicryl is known as polygalactine. So how I have remembered it like this: vicryl. So polygalactine, this is like actin video. That is polygalactine and vicryl. So this is 60 to 90 days. Then monocryl. So monocryl, how will you remember? The name is polyglycapron. So see, monocryl, C comes here. And one is mono, so that is polyglycapron. And PDS is polydioxanone. Di is coming, poly is coming, PDS, and this is the plain catgut. Okay, and this why this is marked yellow? Because the plain catgut is yellow in color. We will be summarizing entire color code, don't worry guys. But this is, and this chromic catgut, do you see it looks brown in color? Hence this chromic catgut. And you can also remember when we read about the chromoblastomycosis. So what we say, we have brown colored bodies in chromoblastomycosis, known as the sclerotic bodies, medlar body, muriform body, because they were verrucous wart wala body, brown color. So here also chrome gives brownish color. So this is important. Now coming on to the non-observable, the mnemonic is sleep. S means silk. Nothing to know, no new name. L means linen. Now E. One is ethylone and one is ethibond. So ethylone, that is polyamide, that is nylon wala thing. Okay. So on. This is important. Then ethibond. So ethibond, the mnemonic, it is polyester. So the mnemonic is on ester. People bond with each other. So this is ethibond. Then we have P, that is proline, that is polypropylene. See, the entire name proline comes under the polypropylene. So I think this helps you know the absorbable and non-absorbable. Now coming on to this natural wala thing and synthetic wala thing. So see, if you think the absorbable one, this catgut wala thing is the natural wala thing. So all other 4 are the absorbable wala thing. Now coming on to the non-absorbable. So first 2, this silk and linen, they are the natural wala thing. And this ethylone, ethibond, proline, all are artificial, means synthetic wala thing. So I think this helps you identify. Now if someone asks you proline, so think about whether it comes under the synthetic means absorbable versus non-absorbable. So someone has asked you proline. So proline will come under the non-absorbable wala category, and this is a synthetic. Hence this is a synthetic non-absorbable suture. Now coming on to the classification, absorbable and non-absorbable. See, naturally we already did catgut and chromic catgut. Synthetic we had 4 things. V, C, D. So C is already done. V is vicryl, monocryl. D is Daxon, and D is PDS. Then non-absorbable already done, silk and cotton, natural wala thing. So absorbable other wala thing, that is proline, ethylon, ethibond. This all things are non synthetic wala thing. So what are the things you need to remember about this catgut? So this catgut was founded by the James Hunter, okay, and this was observed from the ileum of the sheep gut, okay, that is basically the submucosa. These things are written at the back, you will see it. And catgut is 6 letter, hence the absorption time is 60 days, and tensile strength acquires by 3 to 5 days, and it ends by 15 days. Then chromic catgut, so this is chronicity, so absorption time instead of 60 days comes to 90 days. This is chromic catgut, it's mixed with chromium. Now monocryl, remember the other name of monocryl, mono means 1 and kryl C, that is polyglycapron. Now vicryl, so vicryl, important thing is violet in color. I think no confusion, vicryl and violet, VI, this is very easy, okay. And this vicryl is known as polygalactin. How do you remember? Act in video, okay, and it dissolves in 60 to 90 days. So how I have remembered it, he has acted in a vitamin ka video. So this vitamin is 7 letter, so to be more precise, many of them refer to it as 70 days, but 60 to 90 days is fine, you can remember like this, okay. And this vicryl is used for all this matlab stones wala thing, okay, that is CBD ka, gallbladder, urinary bladder, suture, anywhere where you can have stone, everything there. Then polydioxanone, okay, that is PDS. So polydioxanone, so how I have remembered it, guys, that is polydioxanone. Non is 9 for me, di means 2, x means 10, 9 into 2 18, into 10 180, that is it dissolves in 180 days. Now then you have polyglycolic acid, that is mnemonic is code, okay. So if you write the mnemonic code DO, that looks like 90 days. So what are the things that have 90 days? One is the chromic catgut, guys, okay. Then you have Daxon, also you can remember vicryl, and this monocryl, okay. This monocryl is like, guys, na, so this monocryl is like just like the death of RBC ka death after about 90 to 120 days. So remember, like after the death of RBC someone cries, that is 90 to 120 days, that is monocryl. So this chromic catgut, Daxon and vicryl have 90 days, catgut has 60 days, and guys, and this catgut has 60 days, and this monocryl has 90 to 120 days. Now coming on to this synthetic wala thing, that is proline, also known as polypropylene. So this proline, it's basically used for vascular repair, this pipe wala repair thing, okay. It's also used for rectus sheath ka suturing, R for rectus sheath, and O is like basically you might have heard of the hernia mesh, proline ka mesh. So it's also used for hernia ka repair. Now nylon also known as ethylon. So nylon, N for nerve, okay. You can also use it for tendon and cataract surgeries. Then polyester has on Easter festival you make a bond, that is ethibond. And you have surgical steel. Now other thing that you need to remember, what are the multifilament suture and what are the monofilament suture and polyfilament suture. We'll be also seeing the mnemonic for that, okay, which is also referred to as multifilament is also referred to as braided sutures. Now see, first we'll see the color coding of the suture material. When we talk about the color coding of the suture material, this plain cat ka gut, okay, so the name is cat gut, but it's obtained from the sheep ka gut. So gut ka color, how will, due to fat and other thing, this looks yellow, I think it's fine. Then chromic cat gut, that is chromoblastomycosis go in, so there are brown colored bodies, so remember it like brown. Then you have blue, that is proline. So if you make it say P can be made into a B, that is BLUE, blue, okay. Then black, imagine someone wearing a black color silk sari, and how is silk sari obtained? From the silkworm, and many around 2,500 to 3,000 silkworm are killed to make one silk sari. So many silkworm, hence this is a multifilament wala thing, okay. Then violet is vicryl, and cotton is white, and monocryl, if you remember, ON, that is orange, okay. So this mnemonic also, if you find useful, you can use it. I did not find so useful, so I did not use it. Now coming on to the monofilament versus multifilament wala thing. So mono means it's single filament, multi means many filament, okay. So multifilament is also referred to as the braided wala thing. Okay, so monofilament का advantage क्या होगा, disadvantage what is it? Okay, so monofilament has single stand. So when you have a single stand, it's easy to insert and take it out. So tissue gliding is easy. So minimal tissue trauma. Tying is smooth because it's only monofilament, but it gives away easily because the strength is not so. Then memory is extremely good. Memory means the ability to go back to the initial state is good. So what are the example of monofilament? Remember, everything is monofilament except for what is not monofilament. That I think makes it more easy. So remember, this vicryl, this silk, and this ethibond, they all are multifilament. See, what's the disadvantage with monofilament? Handling and knotting because single piece so difficult, and ends not burial problem. But multifilament, more than one filament. So guys, bacteria can seep into the surfaces. That is the problem. And tissue trauma is more tissue resistant, so tissue trauma is more here. So see, we have three things that we need to remember here. Okay, that is vicryl, silk, and ethibond, polyester. So how will you remember it? Okay, see, what was the name of vicryl? Vicryl is a polygalactin. I think you can recall it. Act in a video. So what was the name of that video? He was acting in a vitamin video. And when doctor prescribe you vitamin, he generally prescribe you multivitamin tablets. So this is a multifilament. I think this makes it easy. And what was the time? Vitamin 7 letter, that is 70 days, but you can remember like 60 to 90 days. Now coming on to the silk. So it was black in color, vicryl was violet in color. So imagine a lady wearing a black color silk sari, and so silk is made from multiple silkworm, hence this is multifilament. Now ethibond, that is ester bond. So on Easter, many people are coming and shaking hand, making a bond with each other. That is multifilament, and everything is monofilament. No confusion, guys. Okay, just remember braided wala thing, multifilament. You will remember mono wala thing. Please don't go on that trap with poly means multifilament. Like initially what happened, I got one of this suture material. I remember I got vicryl, as vicryl I think I got. So ma'am asked me, can you tell me some more other braided suture material? I just uttered, ma'am, monocryl, because I thought vicryl, monocryl sounds so good, so they must be similar, but it's not like this. It's not like monocryl sounds like polyglycapron. So poly is there, so it's multifilament. It's not like this, guys. For multifilament, you have just three things. That is vicryl, silk, and ethibond. Now coming on to, see, this with this we have already seen absorbable, non-absorbable. If we classify absorbable into braided, non-braided. Okay, so now think about absorbable suture means the mnemonic is VCD. Okay, non-absorbable, the mnemonic is slip. Okay, see. So in absorbable, in VCD, which one of the following comes under the braided? Think vicryl. Vicryl, is it a braided? Yes, vicryl is a braided suture. Then again monocryl, it's not a braided suture. Vicryl means it's a polygalactin, act in a vitamin video. That is multivitamin tablet. Then you have catgut and chromic catgut. That does not fit in this criteria. Then we have Daxon and PDS, again does not fit in this criteria. Now see, again non-absorbable braided silk. Multiple silkworm are used, and ethibond, multiple people making a bond on the Easter. See, and I think if you might have visited the Goa beach, so this braiding of hair is very common in the Goa beach. So when you plan to go to a Goa, so you need to save a lot. Okay, so the mnemonic for braided suture is save. That is S for silk, A is nothing, guys. Okay, V is vicryl, and E is ethibond. I think this helps you remember when you go to a Goa shopping. When you go on a Goa, braiding of hair is very, multiple people will come around you, ma'am braid kara lijiye. So this is very common. So braiding, so when you go to Goa, you need to save the money. So S is silk, V is vicryl, and E is ethibond. I think this helps you remember the braided wala suture, because braids are very common in hairs in Goa. Now coming on to the uses of the suture material. So first of all we have nylon. Okay, so what are the uses of nylon material? So remember it like can't say no. Nylon, no. That is C means it's used for cataract surgery, N means nerves, and T means tendon. Can't say no. Okay, that is nylon. So what is nylon, guys? Recall, nylon will come under which category? So nylon is a synthetic material. Okay, and this is a non-absorbable. What was the name of the nylon, guys? That was ethylon. So this comes under the slip wala mnemonic. So this is basically your non-absorbable suture. Now try same with your proline, guys. Try to recall your proline. Slip mnemonic it's come means it is a non-absorbable suture. It's not either catgut or silk cleaner means again guys it is again guys. So this is a non-absorbable suture and again it is a synthetic suture. And what was the name of proline? It was polypropylene. See, proline, P means it is a pipe-like structure. So vascular structure anastomosis is important. Okay, and it was blue in color. R means rectus sheath. Okay, approximation. And O is like mesh is there. Proline mesh is there. That is used for hernia repair. And this proline has a good memory. Okay. So why this proline has a good this proline has a strong memory? Because it's a monofilament. I already said monofilament has a good memory. Mono is memory equal to memory. Then coming on to vicryl. So if you try to recall your vicryl was known as polygalactin. Okay. So this polygalactin that is act in a video, that is this is the braided suture multivitamin. Okay, so this is the braided suture, and this polygalactin, where does it come? It comes under your mnemonic VCD, means this is the absorbable suture, but this is synthetic absorbable suture. And this is used for bowel, bladder, ureter, CBD, everywhere, like where all you can have stone. Then PDS. That is polydioxanone. Okay, so this PDS, how do you remember? Dioxanone. Okay, di means 2, X means 10, non means 9, that is 9, that is 180 days. So you have a maximum delayed absorption. So you will use this when you have a chances of leakage are high, that is used in the surgeries. So this is used in Whipple surgery during the pancreatico-jejunostomy. Remember, PDS, PGS, remember, pancreatico-jejunostomy. Now coming on to this monocryl. This monocryl is known as polyglycapron. So this is polyglycapron. This again come under the non-absorbable suture. This comes under absorbable suture, but this is synthetic suture. So remember, monocryl. It's like monocryl is like mass substitute, that is subcuticular. People think that I am substitute and then they cry in the corner. That is me substitute. That is subcuticular. Okay. And this monocryl was orange in color. Okay. Now then silk. So this silk is used for two things, that is skin ka suture and for securing the drain, SSS. So I think this helps you recall the uses of the suture material. Now see, this is just for revision. Some extra point. See, vicryl can have other thing, that is vicryl rapid, vicryl plus, and warped vicryl. So this vicryl rapid, instead of this 90 days, only 30 days. And this vicryl plus means it's coated with something. It's antibiotic coated, that is triclosan. Now you have two more questions, that is which one of the following has maximum affinity, which one has minimum affinity. So that is polydioxanone. Its time period is maximum, that is 180 days, and it already has dolog, that is its affinity is minimum. He is happy with 2 people in his life. Then you have Daxon. Okay, so this Daxon has maximum affinity. So remember, Daxon, like X has left him. Okay, so when X has left him, he is trying to make a new one. Okay, so he has the maximum affinity, that is 10 times maximum affinity, and there is an increased risk of infection with E. coli and Staph. ES. Okay, X. Okay, you can remember like this. Now see, catgut, this was discovered by John Hunter. Okay, it is obtained from the ileum and submucosa. This is important, and this is stored in isopropyl alcohol. This is the important MCQ that can be asked from you. See, these are some other things that are written in the notes. You can go through it once. This is not so important. Okay, you may also get across one thing, that is polybutester, that is known as Novafil. Not so important. Now see, when you see the suture material, what are the things that they want to convey you? This 75 centimeter is the material length. Okay. See, then it's a vicryl. Now try to recall with me, guys. I think this will, vicryl is also known as polygalactin. So this is a violet color suture, and vicryl was it, what was it like? Vicryl is polygalactin. So that is vitamin, act in a video of vitamin, that is multivitamin. So this is a violet colored braided suture. Was it absorbable or not? Remember the mnemonic VCD, vicryl V. So means it is a absorbable wala suture. Okay, then EO. What is the meaning of this EO? How is it sterilized? EO means method of sterilization is ethylene oxide, and R means irradiation. Okay, so this is basically the batch number used, how where and all you can use it, guys. Not so important. So this is the important information that you get on a suture packaging. Now see, talking about the needle. So you suture material has to be inserted in the needle. So see, this is the tip of the needle, body of the needle, and this is the source of the needle. So where do you hold the needle? It is hold at the junction of 2/3 and 1/3 from the tip. This is important that you need to know. Okay, and see, so this is basically the needle comes in various curvature. So if it completes 1/2 of circle, 1/2, 3/8 of the circle, 3/8 needle, 1/4 circle, 5/8 circle. So these are various naming of the needle, not so important. Now see, this is a table that helps you classify entire suture material. We will do few as an example. We'll take silk as an example. Try to recall, guys. This comes under the mnemonic of slip, means it is a it is a non-absorbable suture, and this is a synthetic. See, natural, non-absorbable, and multiple silk are required to form. So this is a braided multifilament wala suture, and this is obtained from the silkworm. The name of the silkworm is Bombyx mari. Now coming on to one more example, we'll take the example of this ethylon. Okay, that is polyamide. Okay, nylon. So this is basically nylon ka structure. So now see the ethylon that comes under your mnemonic slip, means it is non-absorbable suture, and also it is a synthetic suture, and this ethylon is a monofilament. Now see, what are the braided suture, guys? So braided या multifilament suture या recall for me, guys. Okay, so one is Vicryl, that is multivitamin ka tablet. Then it is the silk sari, where you need multiple silkworm, and other it is the ethi bond, where there is a bond on Easter people makes a bond, that is the ethi bond. So these are only the braided suture, rest all are monofilament suture, guys. No more confusion now. I think this short the topic of suture material forever. Now coming on to the other topic, that is how to identify your knot. So you may get either simple knot, granny knot, so square knot, reef knot, and surgeon knot. See, these are the knots that I made today. Okay, and I have included the photo because this is a color coded photo. I think you may find it slightly more easier to identify. But if you get a same colored photo, then comes, do you actually know the knots or not? Okay, so these are the photos that I made the knot and included. So we'll deal with these photos. First we'll see, guys, how to identify the knot. See, simple knot, it's very easy. Okay, then see surgeon knot. Okay, so surgeon knot, what do you see, guys? You have a multiple loop. Okay, many loops. Okay, loops are not uniform, guys. One has a less number of turns and other has more. Why? Think like surgeon has to get multiple degree, first MBBS, then MSMD, then something like DM. So multiple degrees, that is like, think like a multiple degree surgeon is having, so it has more loops. That is the surgeon knot. Simple knot is very easy. Now the real problem comes, guys. Okay, that is the granny knot or square or reef knot. Okay, and I often get confused which square is known as reef or granny is known as reef. So see what I did. Okay, so remember this reef. Okay, if someone asks you reef knot, okay, remember this reef is like a rahis. Okay, Rais means one who has much money. Okay, so you can remember Rahis, that is reef and square are the same thing. So granny will be a different thing. So how does Rahis people do? They like to stay up. Okay, when try to see these two very closely. If you see these two very closely, guys. Okay, see, if you see these two very closely here. So what happens, guys, here when you see very closely? Here you see, here the suture material is up, but here the suture material is down. But if you see this knot, guys, both the places this suture material is up. Okay, this light blue color wala thing. So Rahis people tries to stay up, guys. Okay, do you see, guys? See, if it is down, guys, it stays down, and if it's up, guys, you see this black one stays down throughout, and this blue one stays up throughout. Do you see it, guys? So Rahis people like to stay up, guys. Okay, and also how can you identify the suture material? See, guys, if you have reef, okay, and you have granny. Okay, if you write reef and granny, if you try to divide it in the midline, guys, okay, reef on both sides of the midline, you find a E in the reef, guys. Okay, do you see? On both sides of the midline means this suture is midline symmetrical. Just to recall it, guys. Try. If you divide it, guys, it's divisible equally. Hence, it's a reef suture. But granny, it's not divisible equally. Now try identifying this suture for me, guys. Okay, so this is a multiple loop, guys, in the end. Means this is a surgeon's knot. I think no more confusion, guys. Surgeon's knot. Now try to see this suture is up here, but it's coming down here. Means this is the granny knot. Okay, so because both places is not going up. Rahis people will stay up, see, up. Rahis people will stay up throughout. Do you see? Rahis people will stay up throughout. So this is the Rahis wala knot. So how will you see? R for reef wala knot and S for square knot, reef slash square knot. I think the topic for knot is short, the topic of identifying the knot. Now moving on to the next topic. Okay, we are moving slightly towards the instrument part. So these are the various instrument that you see. Okay, so basically this is basically the knife that is used for cutting. So this is inserted in the Bart Parker handle. The place BP is the Bart Parker handle. So we need to know some of things. Okay, 10, 11, 12, 15 and this 26 is important. Rest other things are not important. See 10, so if you see the photo 10, so this has a curved valley, okay, and this is used for making skin incision. Just recall 10 for skin. Then 11 if you see guys, okay, so instead of a curved valley guys, okay, what do you see? The blade is straight and an angle, so this is used for making stab incision, port creation, and drain insertion. So there are three things that you need to remember for number 11: stab, port, and drain. Okay, then coming on to this 12 wala number. Okay, so this 12 number is a concentric shape. I think if you can see the shape guys. Okay, so this is used for removing us the suture. This is important when someone comes before removing suture. That is 12 number blade. Now 15 number blade guys, this makes precise and fine incision. This is important. 15 is fine. Fine is F5 15. Okay, I think this helps you recall it. Now coming on to this 26 wala thing. So this 26 wala thing has blade looking slightly different than the others. So this is important. So this is about your various number blades. Now see, this is the table for your surgical instrument. So here we have discussed all the surgical instrument in one page. Okay, further I'll be discussing each instrument one by one. Also have included all the drills that may be asked for your exam. All the this how to remember the color coding of your cannula, also the Foley's catheter and other uses. See, first is a Lankenbach retractor. So this is the L-shaped retractor guys. I think you can see the L. This is the L-shaped retractor. Then you have a Morris retractor guys. Okay, then you have a Zernis. Do you see? It looks like a Z. So so make the C silent. Journeys retractor. See the C silent. So journeys. Okay. Then you have a Volkmann retractor. Okay, this is also known as cat's paw retractor because it looks like a paw of a cat. Then you have a Devers retractor that is used for liver retraction. This Devers retraction, this looks like a D. This Devers retractor. Then you have a Alice tissue holding forceps. So this ends will have a marking in order to hold the tissue. Then lane forceps. It looks like a two lane is there. Okay, two-way pathway. That is the lane forceps. Then Babcock forceps. Okay, so this Babcock forceps is used for holding tubular structure. Like if you might have attended your OBGYN posting, in order to hold the fallopian tube for ligation, Babcock forceps is used if you have an open ligation. Then this is the Kocher's artery forceps. So this is the hemostatic forceps that is used. So don't worry about the images guys, that's not clear, I know a bit, but we will be doing all the images just now guys. Okay, then this is the D Bacchus grasping forceps. This is the normal two-thread dissecting forceps. This is very common guys. This is the Kocher tissue forceps. You can see guys, this Kocher tissue forceps, how is the end guys. Okay, so this Kocher's tissue forceps, do you see how is the end guys? Then this is the Ramplay's sponge holding forceps. You see the end guys, in order to hold the sponge, and there is no serration because we don't need such good grip. Okay, then what are the other instruments that are important guys? This is Lister sinus forceps. Remember, this is used for incision and drainage using the Hilton's method, and the important thing is that it does not have any ratchet. This is important. This is the Dowen's retractor. So where this is used? In order to retract the bladder. If you might have seen your gynec surgeries like removal of fibroid and other thing, this is very commonly used, this Dowen's retractor. Then this is the Disjargens's choledocolithotomy forceps. This is again important. Then we have Dowen's intestinal clamp. See, there is serrations throughout it. Okay. Then we have the Cayley's rectal speculum in order to examine. Then surgical blade, we have already discussed all the surgical blade guys. Okay, now coming on to each instrument one by one, guys, so that you get a good image, because this is slightly less clear. Okay, so this is scalpel, scissor. You may have either Medzeimer scissor or Mayo scissor. So this Medzeimer scissor are the long scissors, guys. Okay, and this Mayo scissors are the short scissor. This is the tissue forceps. This is the coacher's clamp, guys. Do you see that? It is traumatic to hold the tissue, guys. Okay, and this is Alice and your Babcock wala thing. Okay, see, this Babcock is like a to hold the tube, guys. The space is there, and this Alice has a slightly curved rounded jaws. Then you have various size of the suture. So higher number indicate larger diameter of the suture. See, this braided and the monofilament suture already done. This needle shape already done. This is the Deaver's retractor, guys, only to hold back the abdominal wall. Then this is the Journey's retractor, that is Jet-shaped retractor. This retractor, guys, it's the wheat liner retractor, also known as the VT retractor. And for suction, just one suction is important, that is the Yankor suction tip. And see, this energy system, this is the monopolar cautery. So monopolar cautery, you see yellow and blue. So this blue is acts like a glue, that it helps to coagulate the tissue, and white is used for cutting the tissue. So both cutting and coagulation takes place here. And this is the harmonic scalpel. Now laparoscopic instrument, if you see, so this laparoscopic instrument has a camera, and these are the trocars, okay, through which is inserted, and then through this we insert the instrument. These are the laparoscopic instrument. So we have two methods of creating the pneumoperitoneum. One is using the Varis needle, and other is using the Hassan's method. And here in laparoscopy we use the CO2, that is at a pressure of maximum around 25 mmHg, 15 to 25 is used. Coming on to each instrument one by one, guys. Okay, we won't waste much time, but we'll see the important thing. See, this Deaver's retractor, it looks like this, guys. It's a big instrument. So in order to hold bigger structure like abdominal wall, cholecystectomy. Now see, Doen's retractor. So D and B sounds like this. Means this is for to retract the bladder. Now see, we have two things, Doen's and Morris, guys. If you see Doen's, guys, Doen's has a deep curve, guys. Okay, because it needs to retract the bladder. And this Mauritian has a small curve, and this line which is attached is a straight line, and here it's a curved line. Then this is the Morris retractor, guys, a small curve wala thing. Then this is the Morrison retractor. Then this is the Lankenberg L-shaped retractor, guys. Okay, so to retract superficial and rarely the deeper structure. And this hole, the space is there in order to make the instrument light, so that you may hold it easily. Then this one, this is a jet-shaped retractor. Do you see, guys? It is a Journey's retractor in order to hold again the superficial structures. This instrument is very, very important, guys. Do not miss it out, okay? So this is basically a Humpys knife, which is used for skin grafting in order to harvest the skin to graft at some other side. So in the next topic, when we will be talking about the trauma wala video, we'll be also discussing along with Bun's topic of plastic surgery and the graft wala. There again we'll discuss this. Then this one, this is the Moni hand clamp. Do you see, guys, how is the serration on this? These are basically the longitudinal lamba wala serration. Hence this is relatively atraumatic. So where do you want it? In order to hold the stomach during your gastrectomy. If you hold with a traumatic instrument, the bowel may rupture it, and this may create a very good problem for you. Okay, so we use here Moni hands clamp. This is again one of the more bowel clamp, guys. Okay, again, do you see, guys, how it is? So there is longitudinal sedation. So this makes it relatively atraumatic, guys. Okay, and it is used to clamp this. See, this is a Jaws thyroid retractor used in thyroidectomy. Now see, this is a proctoscope, which is used to visualize the rectum and the anal. Okay. Then this is the straight scissors, guys. Okay, when you see the scissors, guys, you might have think, why cannot we use normal scissor as compared to surgical scissor? So what happens in normal scissor, the joint is closer to the handle, so it's difficult to make it to less space structure. While in surgical scissor, the joint is closer to the blade as compared to the handle, so it gives you a wide range of mobility. This Medzeimer scissor, long scissor. This is a Mayo scissor, that is a fat type of scissor. Okay, after eating Mayo, you become fat. Now see, Medzeimer dam. This is the needle holder, guys. So what happens in the needle holder? How do you hold the suture? So it's hold at the 2/3 from the tip and 1/3, and this is held in this crisscross serration wala thing, so you have a better grip. Then Artery Forceps, and this is the tissue holding forceps. This is simple, I think no confusion. See, Artery Forceps. So what does this artery forceps will have, guys? You will have a joint, guys, okay, and here you have a ratchet because we need to close it, and we have transverse serrations, means this is relatively traumatic wala thing, guys, okay. This is important here, okay. Then you have a right angle forceps. Do you see the right angle here, guys? This is the Kocher's forceps. So this was initially used in thyroid surgery while holding the superior pole. You know, like many things are related to the term Kocher's, guys, okay. That also you need to revise. Then see, coming on to this artery forceps, guys. This is a large curved artery forceps. See the tip, guys. This is a medium curved artery forceps. This is a straight artery forceps. If there is a transverse serration, guys, okay, see, if the serrations are like this, guys, so it will be relatively traumatic. If there is lamba wala serration, as in bowel wala cramp, these are relatively atraumatic. This artery forceps are also known as your mosquito forceps. Like when I attended my posting, I usually heard the doctor asking the nurse, mosquito pass, so I got very confused. So this mosquito forceps are only artery forceps. Then this is the Desjardins collidocolithotomy forceps. So this is basically used for collidocolithotomy. This is the Kocher's forceps, guys, already done, used for thyroid surgery. Okay. Then see. Then this is the Alice forceps, guys. So this is the Alice tissue holding forceps. Do you see the end, guys? How is the ends for this Alice tissue holding forceps? Try to see it, guys. The ends of Alice tissue holding forceps. So this is traumatic because multiple tooth are there. This is the Lane forceps, which is like a straight line, and this Babcock has a space in order to hold the tube. So this is used for basically while we are doing the fallopian tube ligation. Okay, this is a Lane's forceps, already done. This is a Babcock forceps, guys. In order to hold the tissue, wash deferens, fallopian tube, or the tubular structure. This is the towel clamp, Doyne's towel clamp, just in order to hold the towel or this to hold the drape in the place, guys. Then this instrument, this is a Bard Parker knife where you fit the blade, BP knife, which I said, guys. This is other instrument, that is the Forgese Mollison mastoid retaining, is not so important. This instrument, guys, is the Lister sinus forceps. So what is important here, guys? At the end, guys, you see the presence of serration, but this has no box joint, guys. Okay, so this box joint, this ratchet is also known as catch. So this is used for draining the abscess by the Hilton's method, guys, where you go and break open the loculation and you drain the abscess. Then this is the needle holder. You see the serration and the gap to hold the needle. Then this is a rampless sponge holding forceps used to hold the sponge. These instruments are not so important. This is the Balfour self-retaining retractor, guys. Okay, so this Balfour, it looks like a 4, means it looks like you have 4 instruments, 1 2 3 4, hence known as the Balfour self-retaining retractor, guys. Okay, used for pelvis surgery. Now coming on to the next very important part, that is the drain. So if we talk about the drain, guys, we have a Jackson-Pratt drain, we have a Penrose drain, we have a Hemovac drain, we have a pigtail drain or catheter. Okay, so this drain which you commonly see in your ward, okay, these drains are commonly I have seen in my clinical posting down. These are the Jackson-Pratt drain, known as the GP drain. So when the bulb is squeezed, guys, there is the negative pressure that helps in the suction. See, okay, then you have a Penrose drain. So here there is no suction, guys. Okay, just there is a flexible plastic tube, and that is placed on the surgical side to allow any fluid seroma that collects to come out. That is the Penrose. This is the image of a Penrose drain, guys. Okay, this is your Jackson-Pratt wala drain. Now coming on to this Hemovac drain. Okay, so this Hemovac drain is a low pressure closed drainage system, guys. Okay, so basically what happens when there is a fluid collection, this acts like a spring like device. This is the Hemovac drain, guys. Okay, that you see in the photo. Then this is a pigtail drain, when you need to drain any unwanted fluid like pigtail catheter ke through. So this looks like a pigtail tail, hence it is a pigtail water drain. Now coming on to some other instrument. Okay, that is the Ryle's tube, guys. Okay, so how do you identify this Ryle's tube and the infant feeding tube? I often get confused between Ryle's tube and infant feeding tube. Okay, so this Ryle's tube has a length of around 100 centimeter, and you see the presence of 3 lead shots, guys. Okay, and there is radio opaque line, which I don't think you will be visualized. So what is the use of Ryle's tube? To decompress the stomach. Infant feeding tube, again to decompress the stomach and feed the infant. Okay. Now Kerr's T-tube, guys, that is used for CBD closure when you have a bile duct injury, guys. Then this is the abdominal chest drain tube, not so important. This is again one type of drain, that is the corrugated drain. Then this is again, guys, your Foley's catheter. This is very important. I think you might have heard around this Foley's catheter, guys. Okay, so this is used for drainage, infiltrating balloon irrigation and other thing. This is a malachort self-retaining catheter in order to aspirate the content, and this is again a flattish tube. Okay. Now coming on to the next other important topic, that is the color coding of the cannula. So this cannula is one of the frequently repeated topics in your exam. So you need to know about the size, color coding, flow rate, and the uses. Not so important. See, remember the mnemonic. Okay, so what happens, guys? Initially go from down to up. When you go down in the ground, you have the lava, that is orange in color. Okay, so this is your lava. Then when you come from the lava to the ground, you have soil, that is gray in color. When you see on the soil, guys, you will see the leaves of the tree, guys. Okay, so that is green in color, guys. Okay, leaves. Then you have pink colored ka flower on that plant. Okay, when you see that pink colored flower, when you see slightly up, you will see blue color ka sky, that is the blue sky. When you see blue sky, if you see in the sky, you will see the sun, yellow sun, and above the sun there are ultraviolet rays, that is UV ultraviolet rays, that is violet or purple in color. I think this helps you recall the color coding. See, start from 14, it goes from 14 to 26, and even number 14, 16, 18, 20, 22, 24, 26. So someone asks you 20 number, so try to think. We need to go to the fourth wala color, that is down. Sabse pehle it will come, that is orange, then gray, then we will have green, then we will have pink, means 20 gauge is the pink color. I think this will help you. Now remembering the flow rate of this. Okay, so remember this 26 gauge, if you do half, guys, that is 13 ml. Okay, now see 13, then make 20, again double 40, again if you do 20, 40, 60. Okay, 80, this is 80, you can remember like 90 ka double if you do 180. Okay, and this is 240. I think just try to have an idea, guys, where do we use. Okay, and for pediatric use, guys, this 22 to 24 gauge cannula is more commonly used, guys. When you need to have a rapid flow rate, guys. Okay, in trauma patient, rapid large volume replacement, where there you use small size, that is 14 gauge or 16 gauge, because you need to replace the volume quickly. So this is about your color coding of the cannula. I think guys, this helps you simplify entire topic of your suture material, your all the drain tubes, your all the instrument. So anything that can be asked, guys. This was just to practice, guys, polyester and Vicryl. Try thinking at your end, guys, and try to revise it once, guys. Okay, Ithi bond, multiple people making a bond, hence it's a multiflament. This comes under the mnemonic slip, hence it is a non-absorbable wala suture. It's synthetic. Vicryl, guys, Vicryl VCD, that means it is a synthetic suture. Okay, Vicryl is again a multiflament wala suture and gets absorbed in 60 to 90 days. Mnemonic was multivitamin tablet. So guys, try to revise it once, and I'll send across the PDF on the group. Do join the Telegram channel, do subscribe to the channel, and stay tuned for new videos. Happy learning, guys.